it was eventually we are making the end of this successfully, the third international conference for Penny Plus Africa 2023-26. Second, we local organizing committee, we also extend our sincere appreciation to WHO Afro experts that we work together during these 3 days in a mutual manner to make sure that we rectify some of the issues that appeared to challenge the conference, and therefore necessitating this conference to become successfully. Third, it was only 2 years back when we have the same conference in this venue. But our assessment as the local organizing committee, we see this conference this year is even better than the previous one. So what I can say as the chairperson is that Tanzania now has enough experience to host the conference of this kind. But also we are looking forward to see an even excellent conference next year in another country. Last but not least, we wish you all the best while we are going back home, and we wish that you are going to implement the resolution and also the call for action from this meeting so that Penny Plus become just a routine service in the primary health care. Thank you, asanteni sana.
Dr. Hamad Nyembea, Director of Curative Services, was also the chairman of the organizing committee. Can we all acknowledge the good work that they've done by a round of applause? Thank you so much for those candid remarks. But Dr. Hamad, allow me to reiterate the words that were said by Dr. Grace Magembe, the CMO, on her opening remarks, that they should not leave before they have visited and explored Tanzania extensively. So Zanzibar is 15 minutes flight, 1.5 hours cruise, Serengeti, Bagamoyo, these are all beautiful attractions for those visiting Tanzania. I'm not saying tourists, because you probably do not have tourist visa, but those visiting Tanzania, please make time to enjoy Tanzania's beauty. Honorable ministers, distinguished guests, ladies and gentlemen, I now have the pleasure to invite Dr. Grace Magembe, the Chief Medical Officer, United Republic of Tanzania, to also come and deliver her remarks, to then be followed by an invitation to all the ministers to come and unveil the 2 documents, and then Honorable Minister of Uganda will then be invited by Dr. Grace for the closing remarks. Dr. Grace, karibu sana. Let's give her a round of applause.
Honorable ministers, distinguished delegates, ladies and gentlemen, good evening. I think the remarks by the organizing committee have already been delivered by Dr. Nyembea, who was also the chair of the organizing committee. So mine will be very short. One is to thank you for being here and once again for nominating Tanzania to host this very important meeting. But again, I think the beauty of this meeting is what we've been discussing. The rich experiences that came out from all the side meetings and the satellite sessions that we had in this conference. We've had a lot of data. We've witnessed how NCDs are digging into our economies. We've seen how NCDs are really destabilizing our financial capacity, you know, in the health sector, but also in other sectors. And we've seen and we've heard and we've witnessed how really NCDs are digging in the pocket of our people, you know, creating a vicious cycle of poverty. So I think it's in our best interest as African countries to move from data, from research, from stories, from best practices into actions. So let this meeting actually revive and renew our commitment towards addressing NCDs in our specific countries, but also as a region. So I believe that as we move out of this meeting, and when we meet next time, each one of us will have a story to tell. What did we do? What impact did we bring to our specific countries? So I'm looking forward to that. On behalf of the government of Tanzania, and specifically the Ministry of Health, once again, I want to thank all of you. And let me take this opportunity to wish all of you a safe journey when you're going back home. And take your time in Tanzania. As we said before, there are so many places that you can visit to experience the beauty, the warmth, and the hospitality of Tanzania. Please use that opportunity. Yeah? Don't use another money to have another ticket, to come to Tanzania. This is the time that you have to do that. Having said that, I have now the pleasure to welcome our minister from the government of Uganda, who is going to give his closing remarks. But again, as it was directed, I think we'd like to call upon all the ministers, honorable ministers, to come here at the high table so that our closing ceremony can start officially. Thank you very much, and welcome back to Tanzania. When honorable ministers are here, I will not sit until when they arrive. That's how we do it in the African way.
I'm sure we are left with a pint of energy to really clap for the ministers coming on the stage. Kindly take a seat here. Karibu sana, can I have the report books? So distinguished delegates, ladies and gentlemen, the content of the two documents, which are Pen Plus Operations Manual as well as the report, Scaling Up Pen Plus, Expanding Life-Saving Care for Severe NCDs in Africa. We've had them presented. So for now is for me to request honorable ministers to kindly be upstanding. And we shall start by lifting up the Pen Plus Operations Manual. And for the rest of us, we just need to clap our hands so loud as to officiate that this document is now official. Thank you very much. I request we also take the second book, which is dubbed Scaling Up Pen Plus, Expanding Life-Saving Care for Severe NCDs in Africa. Kindly, honorable ministers, hold that as well. Let's all put our hands together for that as well. Fantastic. Honorable Minister of Health from the Republic of Uganda, you've already been invited to give us your closing remarks. You have the floor. Karibu sana. As he comes, let's usher him with a round of applause. Karibu sana.
Thank you very much, Director of Ceremonies, Your Excellencies, the honorable ministers from the various countries present here, all of you distinguished participants in your respective capacities. I have been given two tasks. One, take you through the call to action, which is a brief statement, and then give you some closing remarks. I am mindful of the time, and therefore I will try to be a little bit brief. I do not know whether the organizers have arranged to put the call to action on the screen. If you have it, please cast it on the screen so that we read it together. This is a call to action, the third international conference for Pen Plus in Africa, Dar es Salaam, Tanzania, 23rd, 25th June 2026. Advancing progress towards SDG targets for NCDs in Africa by 2030, reflections on Pen Plus implementation, progress, challenges, and the future. We, the participants of the third international conference for Pen Plus in Africa, commit to 1. Elevate severe and chronic NCDs as an urgent health and development priority. 2. Advance integrated early detection, diagnosis, treatment, and long-term care at all levels for severe and chronic NCDs, with emphasis on primary and fast referral care. 3. Promote people-centered care and multi-sectoral collaboration to reduce premature mortality from severe and chronic NCDs, leaving no one behind. We call on governments to 1, fully implement PEN and PEN Plus interventions to expand equitable access to essential services for severe and chronic NCDs in collaboration with World Health Organization and partners. 2, uphold and finance the PEN and PEN Plus regional strategies, ensuring access to care for individuals with severe and chronic NCDs, regardless of geography and socioeconomic status. 3, strengthen national health systems, improve surveillance and data capturing for severe and chronic NCDs, and ensure availability of affordable essential medicines, diagnostics, emerging technologies, and institutionalized prevention and care. 4, demonstrate strong leadership in public health by increasing domestic investment and fostering inclusive partnerships with civil society, development partners, and the private sector. 5, integrate World Health Organization PEN and PEN Plus conditions into universal health insurance package to alleviate the financial burden of NCDs on the most vulnerable populations. We urge the World Health Organization to intensify its leadership, advocacy, and convening role with partners, governments, and the private sector to keep severe and chronic NCDs and universal health coverage at the center of political and development agendas. 2, leverage their strengths in normative functions to develop standards, tools, and guidance documents to support the implementation of the PEN Plus framework in Africa. 3, support resource mobilization, promote innovations, and facilitate cross-country learning and coordination. And 4, leverage existing collaboration with UN agencies to address severe and chronic NCDs in children. We call on development partners, donors, and other UN agencies and the private sector to significantly increase investments in children and poor populations suffering severe and chronic NCDs, promote research, innovations, and local production of affordable essential medicines and diagnostics. We respectfully request the World Health Organization Regional Director for Africa to get the Ministers of Health to affirm and present the ministerial communique during the 76th session of the Regional Committee for Africa in August 2026 in Addis Ababa. We further respectfully request African governments to champion this call to action at the 2026 UN General Assembly high-level meeting to galvanize global commitment and secure greater investments for severe and chronic NCDs. Distinguished ladies and gentlemen, that is the brief call to action that has been put together, and I do hope this summarizes the pulse for the last 3 days, the kind of discussions that we have had. So I congratulate you and thank everybody that has participated in these important discussions. Finally, let me now switch to the closing remarks. I have written closing remarks, but in the interest of time, I will not read them verbatim. I will speak to the remarks without reading the remarks so that we can save time. And let me just make a few comments. One, speaking at this podium as a minister from Uganda gives me great pleasure, because for those of you who know the history of East Africa and the history of the continent, there is a very strong historical relationship between Uganda and the United Republic of Tanzania. And we as Ugandans, we are forever grateful to the people and the government of Tanzania for the role you played in the past in the liberation of Uganda. If I had time, I would give you the stories, but that will be for another day. We know, for instance, that Tanzania, especially University of Dar es Salaam, was the political laboratory in our region, to the extent that even our president, when he was admitted in Makerere University, he refused and opted to come to the University of Dar es Salaam in the preparation for the political struggles, which eventually resulted in him assuming that powerful office of the president of Uganda. So we have a lot of appreciation to extend to the people of Tanzania. I'm therefore delighted, and I want to thank you for selecting me among the ministers to represent the honorable ministers here to give these closing remarks. We have had a very engaging 3 days, and let us congratulate ourselves, those of us who have made it the last day. I think we give ourselves a big round of applause, because I know all of us are busy in our respective offices. A number of colleagues could not hold on up to the last day, they had to fly back. And therefore, I want to register appreciation to all of us, the honorable ministers, the World Health Organization team that are here, all of you, the technical officers from the various countries. I want to say thank you very much for the 3 days of very serious work here in Dar es Salaam. Let me also appreciate the leadership and the people of Tanzania. Particularly, let me appreciate the Minister of Health for the leadership, for the organization, for the arrangements. And we want to say thank you very much, Madam Chief Medical Officer, and through you, extend our appreciation to the Honorable Minister. Both ministers were here. We began with the opening ceremony where the minister represented Her Excellency the President, and also the Deputy Minister was with us yesterday. So we want to extend our heartfelt appreciation to the Ministry of Health and indeed the government of Tanzania. And also we extend our appreciation to the World Health Organization, because together with the Ministry of Health, the main organizers and the other partners and the organizing team, thank you very much for putting up a very successful conference that has engaged all of us the last 3 days. And I'm sure all of us are not the same the way we came in terms of appreciating the burden of NCDs in Africa. So thank you very much, WHO, Ministry of Health, and the other partners for putting the energies together to invite us and also have a successful conference. We would like to appreciate the hospitality extended to us, this beautiful city of Dar es Salaam, and also add my voice, although I would have invited you to Uganda, but to say the delegates should explore the beauty of Tanzania, because you may not know Tanzania in full if only you come to Dar es Salaam. So adjust your tickets to explore the beauty of Tanzania by going beyond the hotels where we are staying. So I am giving you additional support, Madam Chief Medical Officer. But we appreciate the hospitality extended to us. We sit here as political leaders, as technical officers in the African continent, and we have reflected on the burden of disease within our continent. And like we'll be discussing, we are challenged by a big burden of communicable diseases, but also, like we have discussed the last 3 days, a big burden of the non-communicable diseases. When you look at the map of Africa, I don't see a map of Africa in the room, but I'm sure all of you, I want you to invite a mental picture, and you look at the map of Africa. It is shaped as a question mark with Madagascar as a dot down. That means our mother continent is posing a question to all of us. With this huge burden of NCDs, what are you prepared to do? That's the question Africa is asking us. If you're a Minister of Health like myself, if WR, like our friends, I see you, if you are a technical officer in the Ministry of Health, a medical doctor in a health facility, the continent is posing a huge question, the way it is shaped, that in your space where you are, what are you going to do to reduce or eliminate this burden of NCDs in Africa, in Uganda, in your respective countries, in your community? Because our discussions here have confirmed the huge challenge in our hands, in our communities, in Africa. So the continent is posing that question. So as we go back to our respective countries, let us do a lot of reflection and try to get the answers to that question. And I think the many discussions we have had here, the presentations, the call to action, the documents we have launched, all speak to this issue. But all of us should leave Dar es Salaam energized with the highest level of commitment to go and confront this challenge of NCDs and other health problems which afflict our people in our various communities. When I sit in an office as a government minister, I always challenge myself. I have been appointed the Minister of Health for Uganda. But when you look back at the community that you lead, the burden is big. The disease burden is big. And I always challenge myself, what is it that I can do to make the situation better for the people of Uganda, where I've been entrusted to be in charge of the health sector? I look back at that question, the question mark of the map of Africa. What is it? The time I will be as a minister, what is it that I can do to make sure the NCDs can go down and other health challenges that our people face? And therefore, let's go back with that commitment, with enthusiasm, with a zeal to do something so that our African people can be free from this challenge of NCDs and other problems as we all know them. I think there is a bigger call for all of us to work together because our challenges are more or less the same. Whether you look at from West Africa to Southern Africa to Eastern Africa to Northern Africa, the challenges are the same. And this conference has been an opportunity for us to share and learn from each other. If there is something which works in Malawi, maybe Uganda should not reinvent the wheel. We should have a framework where we learn from each other, we support each other, and we coordinate ourselves. And I would like to appreciate the World Health Organization for the tremendous work that you do in terms of supporting our ministries and governments, and also facilitating that coordination so that the health systems can function in our countries, but also in our continent. So WHO and other partners, thank you very much. So from here, let's go back to our countries, ready to work together, to share lessons, learn from each other, so that next when we meet, we can say, yes, from Dar es Salaam, there are these achievements, there is this progress, there are these results. We should be moving in a direction which makes our communities much better than the way they are today. So I thank you very much. Once again, Minister of Health Tanzania, the people of Tanzania, thank you very much for hosting us. And all of you distinguished delegates, thank you very much for the commitment, the facilitators, those who made presentations and shared experiences. Thank you very much. We as ministers, we go back to our countries energized with a lot of enthusiasm and ready to take on the challenge of confronting this big problem of NCDs. I thank you and wish you God's blessings. So with that, I want to declare the 3-day third international conference on the Pen Plus regional strategy to address severe NCDs in Africa, ICPPA 2026, officially closed. But the conversation continues. Thank you very much. May God bless you.